Well, welcome everyone. Thank you so much for joining this week's Ask the Expert. We have two II alum, Dr. Molly Muedeking and Beth Supik here to talk about basic veterinary care for your polo string. We're going to ask everyone to go on mute for the presentation. They're going to give a presentation and then we will open it up for questions and answers at the end. If you have a question during the presentation that you just can't wait for, you can use the chat feature and we'll monitor that and we can pop those in as needed. So with that, I'm going to turn it over to Molly and Beth, and thank you guys so much for taking time out of your day to run this for us.
Oh, thanks for asking us.
Yeah, thank you. All right, we're gonna try technology, so hold on. We're gonna figure out how to share our screen and then we should be good to go. All right, hello everybody. I feel like we know most people, but we're gonna introduce ourselves. I am Dr. Molly Muedeking. I went to Garrison and then I went and played polo at UVA. I took a couple gap years and then went to vet school at the Royal Vet College. And now I'm back in Baltimore practicing and bothering Garrison Forest Polo. So this is me on a Garrison Polo pony showing. She did wonderful. And then one day I came out and rode her and realized that she was missing quite a lot of muscle in her hind end. And, you know, we kind of diagnosed it as a old pelvic fracture with muscle atrophy. And the last picture is her looking for snacks, very much enjoying her retirement.
Hello everyone, I'm Beth Supik and I learned how to play polo at Garrison Forest, and then I went to Colorado State for 2 years and played out there. Took a bit of a hiatus from polo for probably 5-6 years, and I've circled back and have been managing tournaments for II and Knights for I think six years or so. So I love being a part of the II community. So on my pictures, I currently, when not doing stuff for polo, I work for the steeplechase owner and their personal trainer. So I'm in charge of everything racing and riding and schooling and stuff like that. So those are two of the horses that I work with. The chestnut is Ebenor and the other one's El Jefe Grande, both timber horses. Jefe, the bay, is hunting. Fox Hunt are timber horses. And Molly had to have a picture of my dog Waylon, so that's him. So yeah, my parents were both professional trainers in the hunter jumpers and flat racing. So born into it and did it as a child and choose this lifestyle as an adult. And so that's it. Let's kick on with the thing.
And Beth is in charge of all tournaments. She just has to listen to her. So the things that we're going to talk about are, we're just going to go through some basic stuff. So we're going to talk about vaccines, warming, and then how to keep it all organized. And then we're putting in a little bit of a plug. We're doing another talk about nutrition and how to feed a polo pony on August 6th. So you have to come back. And then basically we're going through some common emergencies, both in the barn and on the field, and when to call the vet. And just as a preview, you always call the vet. Okay, we're good. All right, so we put together a little thing. Beth's going to go through it as to, you know, some things that you want to keep either in the trailer or in your tack room.
All right, so first of all, it's always good to have a couple different types of medications. These you have to get from your veterinarian, and you should be advised by your veterinarian as to how to administer them and when. I also advise any medications to be under lock and key, and only certain people to have access to them that are knowledgeable, responsible, and can take care of that sort of stuff. But some of your basics, not limited to, but would be Banamine, Bute, Ace-Promazine. Banamine and Bute are anti-inflammatories. Ace-Promazine is somewhat of a mild tranquilizer. There's variations thereof in all those categories, but those are some of the basics. One of my favorite things to have, which also you have to get through your vet, is SSD silver sulfidine, whatever that word, diazine.
Sulfadiazine.
It is a great topical cream for cuts and burns, abrasions, and so forth. It does not test in a drug test, so I think that's one of my favorites. Betadine scrub in solution to help clean the wound. For your abscess kit, you need a hoof pick, ictamol, some sort of drawing salve. Typically ictamol, animal Intex, which I love, diapers, vet wrap, duct tape. Really Gorilla Tape is better than even duct tape, and the wide Gorilla Tape is even my personal favorite. Vet wrap, I definitely recommend the 3M vet wrap. There's some cheaper products, but life is too short for cheap vet wrap in my opinion, so the 3M is definitely a better choice. Other things would be hoof testers or nail pullers if your horse would spring a shoe or shift one. And the next slide, so those are just some, yes, then we have gauze. You can either roll gauze or the 4x4s. Vet wrap, as I already talked about. Standing bandages, the cotton as well as the longer bandage that goes over top, or you could use a polo bandage if in a pinch, or vet wrap. Another one of my favorite things are called zero forms. They are little medicated little strips. They come, and you can even get those on Amazon. You do not have to get them from a vet. They're great for wounds and then to put a bandage on over top of. Scissors, Vaseline. Another thing that's not on there is sheet cotton. You can get a roll of sheet cotton and you can put that under a horse's bandage or under a polo before you play if they have some sort of a cut or a skin funk issue. Sheet cotton is great for a million things. Dermagel is another favorite of mine. You don't need a prescript for that. You can get that on Amazon. It's just a really good topical cream for various cuts, stitches, things like that. The cheaper version would be triple antibiotic cream. And alcohol. I usually put my alcohol in spray bottles, and I typically only ever use the 70% rather than the 90%. So those are some of your basics, certainly not limited to, but some of the basics.
Things to keep around.
All right, that's it, Molly.
So vaccines is something that, we sometimes pass over when we're talking about polo ponies, but it's something that's really, really important. And a lot of reasons to vaccinate your horses is because a lot of these diseases can be communicated to humans. So rabies and West Nile is a big one. And so all of these vaccines on this page, so rabies vaccine, rabies, East, West, West Nile, tetanus over here, and then flu rhino. These are all core vaccines that horses should receive at least once a year. So rabies, the encephalitises and West Nile, and tetanus. So a lot of times the West Nile and the encephalitis and the tetanus are all in one vaccine, and then the rabies is separate. But all of those need to be given in the spring, and they need to be given annually. So a lot of times there's some questions about who gives them and what and everything like that. But, the main goal here is to say that rabies has to be given by a veterinarian, and it has to be done every year, along with the next two. Now, flu rhino is something that is a disease that can be communicated between horses when they are under stress or there's a lot of horses together. So I like to think that, tournaments are a really good time for all these diseases to spread. So flu rhino is a vaccine that we give twice a year. And so I usually do it in the fall and the spring. And the things to remember about flu rhino is that it's necessary for a health certificate. And so you have to do that before you travel. These other vaccines on this slide are also important, but more of I call them risk-based because it's a good discussion to have with your veterinarian about which vaccines are necessary for your horses based on both the geographical area and what you're feeding and some other factors. So botulism is a big one that we talk about when you're giving round bales, when you're feeding with round bales. If you're feeding with round bales, I really suggest doing a botulism shot just once a year. Potomac horse fever is really prevalent around here in Maryland, Virginia, Delaware, Pennsylvania area. So that's something that we also discuss. Strangles is another really big one that's regional. I know it's really big out in California, and then in big barns with lots of people moving around. So those are all things that can be given at different points throughout the year, but it's also something to maybe bring up as a discussion with your vet to see if those are if you're good candidates to have those vaccines, while the other slide just shows you vaccines that you should get every year. The other kind of important things that are worth mentioning is that a Coggins, and so most people don't know, but a Coggins tests for something called equine infectious anemia, which is spread very quickly through biting flies. And so basically the US has not quite eradicated it, but very much significantly decreased the prevalence. And the reason why is because every horse needs to be tested every year. Another point is that to travel or to go on the interstate between states, that this is something that's really necessary. And I know it's necessary to compete in a II tournament. A health certificate, what it does is that it's something that your vet will come out and do, and she will come around and take all their temperatures and make sure that everybody is healthy and fit for travel. So again, this is something that you need to travel between states, but it's again something to talk about with your vet. But I just wanted to give you guys an example of what it looked like and why you need to do it. Yeah.
Just want to jump in there. We're talking about health certs and Coggins and vaccinations. As it pertains to the present time when you are shipping horses out of your area or out of your region, even across international borders, make sure that you are up to date with what is needed, especially to go to Canada. Sometimes a Coggins has to be done within 6 months rather than a year. Most people will get their Coggins done on January 1st, and it's good for the whole year. But just know for any sort of international travel, or depending on if like the EHV virus is like really prevalent in certain states that might be quarantined. So just always make sure that you are up to date prior to traveling, like a week or so in advance, to make sure you have proper vaccinations. Certain facilities will require you to have certain things. So just make sure you really dot your I's and cross your T's ahead of time before traveling.
And it takes about 2 weeks to come back, which we vets sometimes forget to. So.
Yeah.
All right, so this is another topic that maybe isn't as glamorous as talking about some of these emergencies we'll come up to, but it's something that's really, really, really important, especially because we have lots of horses coming in and out of herds. So I've broken it up. So we're going to talk first about what we call as moderate shedders. And so, what I like to think about is that, it's the pole pony that has no problems, has normal weight. And then this lays out a worming protocol for something that's March, July, and kind of in the fall, November. The best way to know what kind of wormer your horse needs is to provide a fecal egg count. So what that does is that your vet will take a sample of poop and they'll look at it under a microscope, and then they will tell you exactly what worms are in there. To make sure that we're worming effectively, I've laid out this worming protocol that usually works for most horses. And so I've given you all of the different brands that you can save and, incorporate into your different programs or into your personal horses as to, what worms are prevalent during these time periods. The next thing is that for these high shedders, so, horses that if we did a fecal egg count, we say, oh my gosh, there's so many worms in there. And for horses that maybe come in and their coat doesn't look so good, they're losing weight, or they're new to your herd, I would change up the protocol a little bit differently and worm them 4 times a year. So all of these different wormers on here, it gets to be really boring, and I might have missed this class in vet school because it's, not the most glamorous, but what this does and what this outlines for you is basically what worms need to be addressed at these different times a year as they're coming through both their pre-patent period and they're growing on their fields. If you follow this will cover most of your horses, but as a vet, I would always say to do a fecal egg count because that'll tell you exactly what you need to use.
Okay, so more about worming. Love this little diagram that we have. Ways to decrease the parasite load without worming. It's always just important to remove the manure from your pens and fields regularly, pick out, harrow, and drag. Avoid overstocking your pastures. You know, the cleaner you can keep them, obviously, the better to keep the flies down. Take home. Let's see. I can't even.
So basically, if you remember nothing else, this is what you should worm your ponies with, unless you're having a problem. So remember these things, take them back with you, take a picture. But this is really, when I tell people, if you're not going to do a fecal egg count to how to worm, this is what you should do. So take a look at that, and you can use that in your own barn. Another thing that I think is really important especially when we're talking about all these ponies that work really hard and, you know, to receive their kind of minimum care from a vet, they should also get their teeth done every year. So on the top there is a really great picture of all of those really sharp points. And so that part of the gum is what, you know, kind of scrapes along when they're playing. And so those can cause ulcers in their gums, which are super painful. So this is why, you know, in the bottom is what happens and what it should look like once your vet is done doing dentals. And so this just helps to make sure that they are making sure that they're grinding surface so that they are eating all their food and getting all those nutrients that you're pouring into them, along with playing well and with less pain. So this is my big plug. I think this is really important that sometimes gets left out.
Absolutely. All right, so next one is keep records. I think it's really, when you're taking care of a string of polo ponies or any horses, it's first and foremost, say you're like starting with ground zero and you've never taken care of the said string, you don't know anything about them, it's going to be really important that you identify every single horse and know how to identify every horse. I remember my first summer taking care of polo ponies. The summer after my junior year, I had 6 plain bays, and I was like, oh dear God. You quickly can figure out their personality types and their conformation and so forth. But make sure that they are identified properly. There's plenty of examples of times where horses have been mixed up. You also want to use we have a couple different suggestions for how to keep your records. This is a screenshot of Jenny Schwartz's records of a spreadsheet that she keeps on the polo ponies here at Garrison. So thanks, Jenny, for contributing this. So that just really, you know, if you just write it all down, like whether it's electronically or by hand, just keeping really good records. I know for myself, I cannot remember everything, so I write down everything as much as I can. I'm a big lover of whiteboards. I love whiteboards in my feed room. I love whiteboards like in the tack room or in a centralized place like in a barn aisle. So you are aware of like which horses you have, maybe possibly where they're located as far as stalls or fields or where they get turned out, what they get fed, what the schedule is for the day, and for the projected future, a farrier list, most importantly, emergency contact list, which would be like your vets, your blacksmith, you know, the trainer or the barn manager, the farm manager, like everybody's numbers centrally located and possibly in various different places so that it's just really quick and easy. It's also good to put all those numbers in your phone, some of them like under your favorites, so it's just really quick and you can just hit those numbers. Also, it's good for horses coming back from layup, you know, like to use like a big calendar that's a whiteboard so that then you can say, okay, well, so-and-so is you know, recovered from an injury and they're going to walk under tack for a week. Then the second week they can start to jog, and then by the third week they can start doing a little canter work or whatever. You can just map it out and you can visually see it, and as well as games, tournaments, just big events that are coming up. And you just, you know, communication and organization is key in any industry, and horses are certainly no different. So the better you can get everybody in your club on board and they are clearly aware of like who those are in charge. So, you know, obviously if there's an emergency, you call the vet straight away, but, you know, call so-and-so. If that person's in class taking an exam, then call so-and-so, you know, and how to proceed forward. I also keep a daily log on my horses. It's just a a hardbound notebook that's sewn, not spiral, because I don't want the pages to fall out. And I just buy the tabs, and each horse has 6 to 8 pages, and I write down any special instructions, any just little things to note about, like so-and-so will try to get a gas colic when there's a huge swing in the temperature, so-and-so's cinchy, so-and-so this, or whatever, so that you can just create as much data on each horse as you possibly have, and that knowledge is powerful later on. So I think that those are some of the big things. Also, as we move forward into like the emergency, like different emergency types of emergencies with horses and stuff, I think my best advice I can give moving forward into the next part of the topic is, if you see an emergency or an injury or something, it is really, really critical. And I'm by no means perfect. We're all human. It's really, really important to keep your composure and have a little bit of courage. You've got to be clear-minded. You've got to set your emotions aside and just be really clear-minded and try to come up with a logical and practical plan of action immediately. I've seen in my lifetime where unfortunately people have led with their emotions and a situation has turned worse because they didn't think it through of how to just like take a deep breath and assess the situation. When you were caretakers of horses, like we're their mommy, we're their rock. So I think it's really important to always be positive and to project that on that horse, no matter what has happened, whether it's like just first time you've ever seen a small injury on a horse, or it's something that's rather graphic or rather severe. Like, it's really important to just stay cool and stay positive for the horse's sake. And of course, that's easier said than done. But that's for that. And I think
this is why Beth and I are doing this talk together, because I get to come in as a vet and Beth gets to tell me what to do. So these are some common emergencies that I have seen. I think most of these are my pictures. So these are all things that you kind of see, regularly. And we're just going to run through kind of some things that, what to do with them, what to do while you're waiting for the vet, and most importantly, it's not to panic. Beth is right. So these are both cases actually that I have going on right now. So one of the things that we see a lot, especially during the summer months, are eye ulcers or just eye problems in general. And things that you're going to be seeing on your end are the eyes being really closed. You're going to see a lot of tear staining down the face. And even if the eye isn't all the way closed, they're squinting. So, anything that's not open all the way is, to be honest, an emergency. And then if you see any tears, or if you see any discoloration in the eye, so the eye can turn kind of like a blue or white color, and all of those things, that we just mentioned are really, truly reasons to call the vet, because, these ulcers, eyes are always an emergency. They really like to get infected, and, they can go south. They can go badly really, really quickly. So the minute you see any of these kind of things is a reason to call your vet. And, a lot of times as a vet, I talk through a lot of these things. I usually go out and see them, but a lot of things that we can talk through on the phone. But basically, you always want to call the vet, and and they'll walk you through some things that you can do in the meantime while they're on their way out. But a lot of times with this, you give some sort of NSAID, so some non-steroidal like bute or Banamine. And then another thing always to have on hand is triple antibiotic eye ointment to make sure that we're covering ourselves for infection. But these eye ulcers can come up from a lot of different reasons. In polo, some things that we see is blunt trauma. So whether it's a mallet or a ball to the eye, sometimes they are caught rubbing. So if you see a horse that's rubbing their eye, that can be from allergies, and you got to make sure that, especially around their feed bin and everything like that, that there's no sharp objects, to make sure that we're eliminating any sort of eyelid lacerations or anything like that. But those are the things to look for, and ultimately you just want to call your vet, because that is definitely an emergency. One thing we see a lot of as well is colic. It's something everybody has heard of, and something that's always scary. Colic, all it means is basically gastrointestinal pain, belly pain. There's a lot of different types of colic and different reasons that cause a horse to colic, but ultimately they all present the same. So they all tell us without words that they're colicking by pawing, rolling, sweating, stretching, not eating. The list really goes on, but anytime you see a horse that's kind of lying down, even if they're just off their food and not dramatically rolling around or pawing, anything that's abnormal, that's kind of one of the first things we think about, is to make sure that, that they're not experiencing colic. So basically some causes of this, so some things that we try to avoid management wise, to try to avoid colic would be, we don't want to have any rapid changes in both routine or diet. Horses are super sensitive and they really are creatures of habit and like to eat at the same time, like to eat the same food. So anything out of the norm, especially if you're traveling, those things can really cause them to have some GI distress. Another reason why we talked about parasites earlier is because they can also lead an overburden. So if they have too many, if they're not worming appropriately, that can lead to colic. In these hot weathers, we're here in Maryland, stuck in the 100-degree weather, and dehydration along with just working too hard can really cause horses to upset that delicate balance, and along with the diet, so it goes too much grain. Ultimately, that is an emergency as well. A lot of colics that, that I end up seeing are, ones that grumbled along and they weren't feeling well this morning. They didn't really finish their dinner or their breakfast. Now they're just kind of lying quietly. Whenever you see that, that's definitely the first thing you want to do is call a vet. And again, there's a lot we can talk about over the phone, but most importantly is that, you need to make that contact with a vet so they can tell you if it's an appropriate time to give drugs or, do they need to come out. While you're waiting for the vet to come out, some things that you can do, especially if your horse is really painful, is you can keep them walking. Now, I always tell people you want to keep them walking, but you don't want to be fighting an uphill battle. If your horse is really painful and throwing itself on the ground, well, don't get hurt. And the other thing is to make sure that if they're lying quietly, you can let them lie quietly as well. And my favorite thing that I tell people is, the first thing I'm going to ask you is to take a temperature. So make sure that's the one thing I tell people whenever I call them, to take their temperature. Lacerations is another big one, another really common emergency. These are some really great pictures, all of which came from my phone. So these are all super common. We're going to, an abrasion versus a laceration. An abrasion is just basically, they've lost a little bit of hair. It hasn't gone through the first layer of skin. And it's, something again to call your vet about to see, to make sure if they need to come out and treat it. With cell phones, you can send me pictures and I can tell you that mostly over the phone. Now, obviously these ones that I've put up here are not ones that we can deal with over the phone. And so, some scary things with lacerations would be if they are over a joint of a horse is always something that we worry about, because they can get a really deep infection. If you ever have a cut that's associated with lameness, and again, my favorite thing, and the first thing I'm going to ask you is that if you have a laceration, does your horse have a fever? If your horse has a fever, that's again another reason why the vet needs to come out. Any sort of swelling, and a puncture. A puncture one is always a vet call as well. And again, an abrasion, just that deeper layer of skin. The one on the picture on the top right is a polo pony who had a kick and an abscess, which I opened and drained. So that's a good one. So again, what are some things you can do to get that here? I say this all the time, but just take a temperature. That gives us so much information. Also, you can bring your horse into a wash stall where the vet can work. And then if you cold hose that area, that helps with inflammation immediately. It's just like running, one of our cuts under cold water. It just helps to really decrease that inflammation and make it a little bit more comfortable. This horse with the laceration on its knee, that ended up being in the joint, and so it needed to go to surgery.
Okay, just say one thing about cold hosing, a good tip. I've seen this. If you're using the hose, take the sprayer off, and you want to not, depending on your water pressure with your spigot, you don't want it on full tilt so that the water is basically just coming right back at you. You want to create like a waterfall effect with the way the water is falling over the injury. So you're going to want to go probably 3 to 5 inches like above that knee in the back, and watch as the water just regulate the spigot so that you have enough pressure, but it's just going down. It's not just hitting the leg and like coming back at you at like a 90-degree angle. And then it's just, if you can't totally cover it, just keep moving the hose back and forth so that you are getting the entire area. I see people just like trigger finger with the sprayer, and I'm like, no, that's not how you do it. So just a little tip.
That's a great tip. The next emergency that we commonly see is something called choking. So in humans, when you choke, it's because something gets lodged in your trachea, so your windpipe. In horses, it's actually when something gets lodged in their esophagus, so the tube that goes down to their stomach. So a lot of times the call that I'll get, it'll be that the horse has all this wonderful goo, whether it's saliva or food, coming out of their nose, and they're extending their neck, coughing, drooling, and it's right after they eat. So a lot of times, it's that call directly after you've fed them, and it's, the cause is basically that they're usually eating their food too quickly, or they have some really severe dental disease that causes them to be that they're unable to chew their food. And that is actually a really classic picture, along with timing. And that is another one of those true emergencies where, they're not going to die, but they do become, as in a human, right, where that's very different. But in a horse, they become very uncomfortable, and it is an emergency where your vet needs to come out that day. And again, there's some things that your vet will talk through with you in the meantime while they're on their way out. But the thing that you can do is to remove all food, so that way they're not adding to that choke. Keeping them comfortable. And one of those old wives' tales that's out there that Beth and I hear a lot is to put a hose in their mouth, and that helps to clear out that obstruction. And I got to say that is one of the things that I hate seeing the most, because the only thing that happens when you do that is that you give them pneumonia. So we have something to do, which is to remove the food, and something not to do, which is do not put a hose in their mouth.
And moving forward after that, if you know that for sure you've got a horse that's like a total chow hound, and maybe they're on more of a pellet diet or whatever type of feed really, is to soak their feed moving forward. You'd be amazed at how much water a scoop of feed or whatever the ration is will absorb. So I typically use hot water and will fill it like at least 3 inches like above the feed in the feed bucket or the feed tub. Wait 15 minutes or so. You might need to add a little bit more because it's totally absorbed it. Now it's just pasty. So just add as needed to make it kind of like a quote sloppy joes, I like to call it.
Call it soup.
Soupy,
good.
Yeah, sloppy joes. And another thing you could do, like a lot of my horses have like pieces of salt block, like the brick style that go in the stalls. And once they get into smaller pieces, you can toss them in there. So they actually have to rummage around the pieces of salt block to get to their feed, and that'll slow them down a little bit. So just things to know.
That's a great tip. That's a really great tip. So now we're kind of going into some game day emergencies. So some things that you could maybe see arena side or field side. We are pretty regional over here because it is about 100 degrees right now. So one thing that I see a lot is dehydration. There's also ways to test for dehydration. You can do a skin tent off of their neck. So you literally just pick up some skin off of their neck, and if it stays there, it means they need some more water. Basically some great things that you can do are pretty simple, although some fields it's hard to do, but really just putting them in the shade drops the temperature by significantly, and that helps them to thermoregulate, so help to really keep their temperature normal. There's been a lot of really great studies that show that large buckets of water and just cooling them off and then sweat scraping them is the best thing to help decrease their core temperature to the point where, they can conserve what water they have rather than sweating it out. Offering water really frequently. I actually saw a horse today that, doesn't really drink well in its stall, but also, so allowing it to go out and drink outside and drink and noticing their patterns of where they like to drink and when. And then one really great thing that I know Beth uses is oral electrolytes the day of the game to try to help promote them to drink their own water and kind of keep all of those electrolytes and those minerals that they would normally sweat out to try to preserve those. Another thing, again, that we see pretty frequently is when horses don't sweat. So the technical term is anhidrosis. What it really means is that they just don't sweat. And so there's a lot of reasons that they don't sweat. Most importantly is that's a discussion with your vet. But the reason why they need to sweat is because that's how they lose body heat. So if they're not sweating, that means that they're basically cooking themselves. And that, basically it's, again, here in this really hot climate, it's something that we need to be really aware of because it's really amplified in that humidity. Horses that don't sweat, what they look like is that they're kind of panting. And so most horses after they play a chuckle will come off panting, but those horses that don't recover as quickly, and along with, if they don't have any sweat, and so you really want to look for sweat on their neck and on their chest and under the saddle pad. That to me is a horse that has been affected by anhidrosis. And so standing out and also when they're, just kind of standing out in a field, not doing anything and just panting, that could be another sign of it. There are some different medications that you and your vet can discuss. But that is something that's really simple that we can look for, as we're cooling out our horses and, and kind of managing them field side by keeping them nice and cool. And again, it's the same thing to do with dehydration. Here's Beth showing us how to properly kind of hose off a horse. But again, having that shade available, dumping large amounts of water in a fan can really make a big difference with these guys who are, on the verge of maybe being a little dehydrated, and then those horses that are non-sweaters. Another thing that we see is something called rhabdomyolysis, and what you've probably heard it as is something called tying up. And so what that looks like is usually it's at the end of a chucker, and they have a reluctance to either move or to stand still because what happens is that their muscles are starting to break down, and it's very uncomfortable. So they are either kind of moving and jigging around, or they really have a stilted gait where they don't want to advance their legs forward. It can be both in front and behind, but they'll take these tiny little baby steps and they'll look like they're moving on eggshells. Another kind of classic hallmark of this is that they have some really hard muscles. So if you feel their butt muscles, their gluteal muscles, they will be rock hard. And so it's muscle cramps that leads to muscle breakdown, and ultimately the worst case scenario is that can lead to kidney failure. So again, this is what makes it a real true vet emergency. Again, they're going to talk through some drugs that you can give to help relax those muscles and help to, decrease any inflammation. There are some dietary changes that you can make to decrease their carbohydrate load. And again, when we talked about with those electrolyte imbalances, which can be helped with giving some gain day electrolytes. So those are all true emergencies to talk about with your vet. The last one, again, is something that we see pretty frequently, are soft tissue injuries. We could have a whole discussion about this because they are pretty common in polo. The reason why they're common in polo is because, we put our polo ponies under constant stress by stopping and turning and asking them to accelerate really quickly. And so with that constant repeated stress, that's when we get those constant, those kind of continual tears in the tendon fibers. And so, with polo ponies, that's super common, but we can change that with some aftercare from after we get off the field.
So one common strategy to help with this is icing their legs. And there are a wide variety of ice boots on the market that can be used. Some have gel inserts, some you just use ice and put in pockets. I do suggest that if you use ice boots to saturate the boot itself, if it's like the neoprene, like the pro-choice style with the Velcro straps, even if you're putting gel or ice into, make sure that you saturate the ice boot itself in water before you fill it. So icing those soft tissue, will really help with just to help keep with any inflammation from starting. in college, what we did at Colorado State, we would get huge Rubbermaid containers, fill them with water, dump a bunch of bags of ice in them, and put standing bandages in there that were like the long bandage was rolled inside of the cotton, and then just like dunk them in there, saturate them, and then put them on the front legs of all the horses. Typically, so like a tendon, check ligaments, suspensories are all sort of what we categorize as speed injuries. And since polo is a speed equine discipline, typically it's going to be the front legs that you're going to want to really zoink in on rather than the hind legs. Not that can't happen behind, but it's typically your front legs. And as a practice, try to get to know what your horse's legs look like and palpate. Just run your hand down the back from the back of the knee to the ankle, and know, some ponies you might get have already had a bow tendon. It's set, it's ugly to look at. If there's a curb, as you can see in these pictures, you'll see that curb. But just know that, just make sure you check to see if there's any heat. But yeah, icing their legs afterwards is probably the best way. If you do them up in standing bandages, you can use 70%, try not to use 70% alcohol on their legs, or beagle oil. I prefer Soar No More, but there's a ton of different types of liniments on the market. Another way that you can also create a bow tendon is by poor bandaging. We don't have time today, but I would have loved to have shown how to put on a proper polo bandage and a standing bandage. As a tournament manager, it freaks me out sometimes. If you put a bandage on too tight, or the pressure is inconsistent between the knee and to below the ankle, that can cause what we call a bandage bow, which is basically lack of circulation, and it's going to cause swelling below this subcutaneous, big words, and cause damage. So you want to really keep an eye on a horse's front legs for sure.
Those are a lot of our really common things. This is a really great photo montage of a wonderfully healing wound on the head, and they usually do pretty well. So thank you guys for listening. We are here to answer any questions that you might have. So let us know.
And just lastly, one other just random thing that I was thinking of this morning. This time of year when it's really hot out and I have like athletic shorts on, or at times at the barn, like I don't wear a belt, but when your wardrobe allows you to wear a belt, do it. If I had $1 for every time I use my belt as a halter on a horse, like in an emergency situation, one gets loose and I'm like, oh, I don't have a halter, it's just one of those little nuggets of experience and wisdom to say a belt can really come in handy. And many times if you're out in the field and you need to bring one in and you're nowhere near your halter and so forth. And then just in general, we all never stop learning with horses, and that there's so much to always learn. And but if you just keep your boots on the ground, you got to get your boots on the ground. You got to get dirt under your fingernails, and just never stop asking questions, and seek out those around you that are knowledgeable and that you look up to and are inspired by, and always ask questions, and get out there in the barn as much as you can, and come 10 minutes early and leave 15 minutes later, so you get to know your horses better. So that's what we've got. So, thanks.
Thank you, guys. We have one question in the chat, which is asking about botulism, going back to feeding round bales. Why would botulism show up in round bales?
Oh, it's a great question, actually. So that's perfect. So botulism is caused by dead, decaying animals in your hay source. And so usually with the way that they produce the hay in round bales, it's more common for dead animals to be caught up in a round bale than a regular square bale. It's not necessarily unheard of, but again, with that risk-based analysis, usually with round bales, it's more common. So that's why I recommend it when you are feeding round bales. That's a great question.
And if anyone else has other questions, You can go ahead and unmute yourself if you'd like and ask away, or if you prefer the chat, I'm happy to relay those as well.
Thank you for Garrison. They've really provided a lot of content for this wonderful presentation. This is a Garrison polo pony who's wonderfully modeling her brand new face. Oh, actually, I guess this belongs to somebody else, but it was at Garrison, so.
And one other tip I would say would be helpful for any of you that are college students running your clubs, to have your vet come out in the beginning of the season and just evaluate the string and just see where you're at, and just to go over each horse, and then to possibly have them come back out when your club members are there, particularly like new students that maybe are completely new to horses in general, and just have your vet, or it doesn't have to be your vet, but somebody that's experienced and knowledgeable to just kind of walk through the do's and don'ts and look through and check for safety issues and so forth, to go over that with all your members. Because in my experience of doing II tournaments, kids just don't know what they don't know, but they're really happy and exuberant to want to learn. So, you know, the more we can pass on that information, the better.
Okay.
All right, so I have a question, since Amy just let me unmute. And I've heard this from various things. So let's say you think you have a laceration that you think you're calling the vet about and you're posing it out. I have been told that if you think it's going to require sutures, don't put any goop on it. Is that correct?
Yes.
Yes.
It's just something else to scrub away. So if your vet is, you know, especially if you have an open laceration, something that looks maybe a little bit bigger than just the first layer of skin, I usually tell people just to cold hose it and keep everything else off of it. It's on the lower limb. You can go ahead and put a bandage on top of it, just like a standing bandage to keep any other dirt or dust out. But, you know, just like Leona here, is that you can keep her in the wash stall and just keep it, you know, away from any other dirt. And usually that's the best protection for it.
And then the other thing is, I know, Molly, you and I talked about this the other day because you checked my horse's heart, but just that, especially with donations coming into college programs, is that when your vet is out there, have them double check them for murmurs or heart issues just before you're putting them into hard work.
That's a really good point.
Yep, I usually check all their hearts whenever you do like your baby's concoction, so that way, you know, you get it checked at least once a year. But that's also a great one. Anytime we get a new horse through, we also make sure to check their heart and everything like that. Just as a new addition, you want to make sure. That's a great point.
We have one from Liz Brayboy.
Hey guys, thanks for doing this, and it's nice to have all the Garrison connections. That's outstanding. So my question is, Beth, you mentioned that you do electrolytes on game day. Do you not feed them every day? Because I know we've been doing them every day.
Oh, I do that in
Go
addition.
pick carrot.
Yeah, so my horses are on electrolytes.
Maybe two.
every
Oh, actually,
day.
never mind.
And then
Oh yes, 2 carrots.
I will supplement that with a whole syringe of like a dose oral electrolyte in the morning, so a couple hours out before.
Okay, great. And it seems like, and the fact that you guys are recording this would be a great session to have all the college programs do with their kids at the beginning of the season. I know our vet used to come out and do a session and say, here are the things that you as a college student can do, you know, turn the bucket clips around, do stuff like that. All the handouts that you guys had and the recording would be a super thing to make sure the programs say, you know, have your kids review this first practice of the season. So thanks for doing it.
Oh, sure. Yeah, thanks for noting that. But yeah, we are totally open to other suggestions, at least for roping Molly into this. But any future topics, you know, it's a really broad topic to have to discuss in 45 minutes or so. So we are happy to go into more depth in any particular area or areas. I also almost forgot to mention that I really recommend that every college, or even a scholastic club as well, if you have the USPA Polo Pony Welfare Guidelines, if you go on the USPA site, and I think you can go through the II page and just keep scrolling down. It's very thorough and it has a lot of great information. I went to my local Staples and got it put in a spiral form like notebook, and it's great. It's got so much in it, and it's just a really quick tool that the USPA has provided. So I strongly recommend those for all tack rooms.
I have a question. It's Leslie.
Hi, Les.
Hey, so this was really, really great. Did this session, was it disseminated to all II kids, or what was the range of emails?
It went out to all of our II contact list. It went on Facebook, and it went out to all the USPA members via This Week in Polo Weekly, the email newsletter.
So in other words, the kids were all notified?
Yes.
Okay, and did we have any on the call?
Got a few.
Had a few or not a few?
We have some, yeah.
Oh, good. Okay, I was just curious.
We can do more. We've kind of thrown out some of the ideas of doing this kind of for different programs, different times. I'm going to video Beth teaching everybody how to do a bandage because she's the queen.
Whatever.
And so
I don't know about that.
I defer to Beth. So yeah, I think there are some ways that we can spread all the knowledge.
Great. We have some more questions.
Go for it. Yeah, go for it.
How often should you clean your mayor's udder?
That's a great question.
Oh, you're going the other way with the gallons.
Yeah, I thought we were gonna go Kelly. So some mares can be really gross down there. It really accumulates in the summer while they're sweating. So a lot of that goes back to making sure that they are really clean after a game and spraying off both under the tail and under the udder. But usually you can clean it out probably about once or twice a year, unless you have a horse that is pretty dirty down there. With geldings, I usually tell people to clean their sheaths about once a year. I usually do it with dental cleaning because they're already sedated. And so that's a really good time to do that as well when you're kind of taking into account making a calendar and getting everything onto a schedule. That's usually when I do all those things. That's a good question.
Great. Robert, you have your question about strangles.
Oh,
Yeah, Molly, what do you, I was just curious, how do you treat for strangles, either intranasal or by injection?
Yeah, so I usually do intranasal because it's shown to have the highest efficacy, because you're basically, the way I think about it very simply, is you're putting the vaccine where the problem is. So the studies show that the intranasal vaccine is the best one that we have. But one thing that's really important with strangles is that, usually I tell people once a year is great, twice a year is truly the best that you can do. And the vaccine is something that I think a lot of people can hear scary things about. It's not a vaccine that I mess around with. It's something that I do on its own day. So you don't want to do it when you're doing other injectables. And you want to make sure that you talk to the owner to make sure that, you have that risk-based analysis. But the intranasal is truly the best one.
Yeah, I agree with you. I think before they had the intranasal, I did the vaccine and I almost killed a horse.
Yeah, so the strangles vaccine can have some side effects. So I always talk about that with the owner. So basically there's a risk for something called purpura, which is basically the body overreacting to the vaccine.
Yeah.
And so, it's always a risk. It's their highest risk is with the strangles vaccine. Intranasal has a mildly decreased kind of risk of that, but it's still a risk that you take while vaccinating it, and you have to offset. Again, that's a conversation with the vet to offset the risk of the vaccine with the risk of getting strangles. And so strangles can be incredibly decimating to a herd, especially if you are coming in and out of a barn with lots of horses. If you have a lot of horses moving in and out, that offsets the risk of the vaccine for me, but it's definitely one that I do not give lightly.
No, I seldom use that nowadays.
What's that?
I seldom use it. I seldom treat or, for strangles nowadays. I do all the rest,
Yeah.
but I just stay away from the strangles.
Yeah, I think once you've had a bad experience with it, it's really hard to come back and say, it's worth it. I think sometimes it's the only thing we can do to cover ourselves if we don't have a closed herd. You know what I mean? Again, I think of a lot of the schools who have different sets of horses in one confined area with lots of horses coming in and out. And that, again, the way to really avoid having to give a strangles vaccine is to quarantine your new horses that come in. So, the best thing we can do is to quarantine horses for 2 weeks to hopefully, we'll see any signs of strangles before, they enter the herd. And then, again, that can decrease our risk for strangles in a herd and decrease the need to have strangles vaccine.
Yeah. Just be careful when you give that intranasal.
I am fully vaccinated against strangles myself. Yes. My aim is off. But.
All right. While we are on vaccines, I've been trying to get Sherry off mute, so I apologize there. But is rabies vaccine regional? In Southern California, their vet has not ever recommended getting it.
Okay, yep, that's really great. So I will say that some areas it is less of a problem. One reason, so I will say in some regions there is a less risk. I would say there's no area in America that there's no risk. Just by default, we are not eradicated of rabies. So there's always a risk. And to me, the way I say it, and I will say that we are in a high risk area for rabies, is that it is something that I can completely eliminate. And because there's a risk of transmission to humans, because I can completely eliminate that risk, I always recommend it. So to me, and according to the American Association of Equine Practitioners, it is a core vaccine. So again, I think that's a really great discussion point with your vet to see, again, that risk-based analysis as to what your horses need. But to me, in my mind, especially dealing with II programs, to me, it's imperative to give because it is it's a transmissible disease. And if I can eliminate that risk, I think it is 100% worthwhile because rabies is a death sentence. So it is something that is a core vaccine to me. That's a great question, though. And it's definitely a discussion to have with your vet.
All right, we have one more question from Carl on Coggins.
Of course.
Carl, I have you showing as unmuted, so you want to...
Yeah, I guess my question here is just from the management side, is what is the easiest way to do this? Because we just had a recent issue come up here in our circuit where we found out a horse had not had Coggins, but had participated in an event, and an event has said, you have to have a current Coggins. But from the management side, what's the easiest way to do this? Because if you're talking about you have 50 players at an event, you're talking a minimum of 100 horses, and that could be a big headache. And, we're going to start doing it. I'm just trying to figure out what is the best way to manage this headache.
Yeah, so I think there's probably a couple parts to your question, but I guess maybe I'll answer it from the vet side, and I don't know that I'm going to answer your question appropriately, is that the way that I do Coggins in a polo facility, in a polo program, would be that I do everything at one time of the year, and to save a farm call, I usually do it along with all of my core vaccines. So again, we're doing everything together, and that's when I look at each horse, I go through, I listen to their heart, I pull a Coggins, and I vaccinate them against rabies, East West West Nile, and flu rhino. So again, it's a big day. I usually set up a whole day for it, but that way I get to see every single horse, and I'm saving everybody a farm call, and we're doing it together. I don't feel like that answers your question, though.
No, because like I'm saying, say, for example, let's go to Texas Arena League. we have 50 players coming in from all over the state, Oklahoma, wherever.
Yeah.
And, you know, each of them bringing a minimum of 2 horses. You know, again, is, you know, and this is also more relates to IIs, like how do you verify for a tournament and not get overwhelmed by the management of making certain that every horse has a Coggins certificate and that's current?
Well, I think if you had somebody that you could appoint at the fields or the arena that is knowledgeable on how to read a Coggins, whether it's the old style ones where somebody's physically drawn in the markings and so forth, or the newer ones that are the pictures, and it's a bit painstaking, I would assume, but you know, time consuming too. But you're just going to have to literally match every horse to the Coggins and know where to check for the dates and all of that, and you know, just have it done in a proficient manner of people continuing to bring their horses up and have their paperwork ready and to show you. I think that's, if I'm understanding the question properly. Emily Dewey might be able to, she has to always like round up all the II paperwork. But it's, yeah.
Thank you.
All right. Oh, wait, there she goes. I think I unmuted her and then remuted her. Sorry.
Oh no. Can you hear me?
Yeah.
Okay, sorry, my computer just totally went blank, but if you can hear me, I'll keep talking. So Carl, what we do for II is everyone has to send their Coggins ahead of time. So sometimes I get them in pictures through text messages. Sometimes people send me a Dropbox folder or a Google Doc folder. Sometimes they email them. So really what might be the best option is to have one point person that collects them all. If people could send you a horse list before their games of who they're bringing. I don't know if you guys want to go in depth into checking every trailer, but that's an option too. But when we do, because we do a pre-tournament vet inspection, the horses are listed out on a piece of paper. So when they jog, they get checked off. If a horse shows up that is not on that list, we see if they have a Coggins on site. We, you know, if we have to check their temperature right then, we do it right then. But that's how we check off all their Coggins. I mean, I can touch base with you more on that too, if that would help.
I mean, that's fine, because I mean, what we were sort of thinking of, and again, I don't know if this is going to come up to your level or not, but like I said, it came up in the Southwest Circuit. I was going to sit there and request copies of everyone's before, you know, like get to me before 2 weeks before the season starts, a current Coggins for all your horses, and you know, make certain they give me a list of your horses, and then a Coggins for every one of your horses. And then, you know, obviously for tournaments, this will be part of the tournament package that you have to submit this. And, you know, and then for, I guess, generically, you know, it would be real difficult to go out and check every horse every time, but, you know, just spot check it, you know, say, all right, hey, you know, how many horses you got here? You know, what are these horses? This one's on the list. Where's the certificate for it? But thank you.
Yeah. I think that's a great idea. If you do it ahead of time, if people know they're going to be playing in Texas Arena League, I mean, it's not like you're giving them 2 days notice to get it done. If they know ahead of time, they should be able to pull it all together.
And one thing logistically as well is that the electronic Coggins now, you have through Global Vet Link, you basically have a link that you can share with people, and it's pretty easy, and it's accessible trailer side. So, you know, I push people to do the electronic Coggins, because that way in these situations where, yeah, maybe you do bring a different horse, something else happens, it's all right there on on your iPhone, basically. Yeah. So that's another logistical thing that, to help with those situations.
Good question.
Thank you.
All right, one last question. We're a little bit over time.
Of course, yeah.
And I think I know the answer to this, because maybe Robert missed it, but Molly, do you generally recommend Potomac vaccines for the East Coast, Maryland, Virginia, Pennsylvania?
So yeah, and Potomac horse is very, very, very regional to our area, to the Maryland, Delmarva area. So Maryland, Virginia, Pennsylvania is where I usually recommend it. And then to go one step farther with that is that, you know, horses that are around low-lying and water, so kind of that swampy standing water, are really high risk. And one reason that I bring it up in this talk, although I know it's, you know, kind of throughout the United States, is that it can lead to some pretty severe diarrhea laminitis. So it is something around here in this general East Coast area, and I think it's traveling a little bit farther north. So up into New York, I've heard some cases, and though I know there's nothing past, I think, Georgia, but in that area yet, something definitely to discuss with your vet, and some other risk factors too.
Great. All right. We are at time. Thank you both so much. This has been fantastic. Really appreciate it. For those of you still on, tune in on August 6th, and we will have Molly and Beth back again for a nutrition talk. And next week on the 16th at noon, we will have Christina Fernandez doing a social media do's and don'ts post like a pro. So the registration for that is open, and we'll be sending out reminders to that. So thank you, everyone. Have a great day, and thank you guys again.
Thanks.
Thanks. Bye.
Bye.